My name is Annabelle, and in this video, we're going to be talking about Propofol. First, I'm going to start by introducing what Propofol is, then we're going to get into the economic, environmental, legal, and societal implications of Propofol. After every segment, I've included an interview with an expert in Propofol, so let's get into it. Propofol is a general anesthetic administered intravenously to induce unconsciousness. Propofol was first synthesized in 1973 by John B. Glenn, a Scottish veterinarian and researcher. Propofol's chemical name is 2,6-diisopropylphenyl. Propofol is suspended in a lipid in order for it to be distributed via IV. Propofol is a weak acid with a pH of 6 and a pKa of 11. Propofol is a sedative that works by agonizing or turning on GABA receptors in the central nervous system. The GABA neurotransmitter working on GABA A receptors are the main inhibitory pathway in the central nervous system. They work like a silencer on your nerves. Here I have drawn the 2D structure of Propofol and the chemical formula of Propofol, which is C12H18O. This is my mom, and she's a nurse anesthetist. She uses Propofol every day. Mom, would you please explain your education and the positions you currently hold?
Yes, my name is Laura. I am a nurse anesthetist. I work full time at Ridges Hospital in Burnsville, and I also am the Associate Program Director for the University of Minnesota in the nurse anesthesia program there. My education is a doctorate degree in nurse anesthesia. And I received that by first getting a bachelor's degree and then going back for my doctorate.
How do you administer Propofol?
Propofol is given intravenously, so through an IV. And usually for my patients, I give what's called a loading dose first, and then they're on a continuous dose, or we call it a drip, throughout the duration of their procedure.
When is Propofol appropriate to use?
Propofol is actually appropriate to use in almost every situation when giving anesthesia. So, propofol can be used as what's called your main anesthetic. So, that means that it is the thing that is keeping the patient asleep for the entire time. It can also be used as what we call a background propofol drip, and that is usually used to make the patient, number one, more comfortable and more sort of sedated when they're asleep when we're also using gas. But also, propofol is an excellent anti-nausea and vomiting medication. We call it an antiemetic, and it's particularly useful for females that are aged sort of like 20 to 60, that really helps them in that post-operative period with nausea and vomiting, which prior to propofol was actually a really big problem for people. So, and it can be used on almost anyone. Propofol is amazing that there is almost no contraindications to propofol. The only sort of caveat to propofol use is that a person who is trained in anesthesia, either a nurse anesthetist or an anesthesiologist, is the person who can administer it. So that's the only thing to think about when administering propofol.
Thank you. Drugs fall under legal categories called schedules, which determine potential for abuse and the potential to create severe psychological and or physical dependence. Schedule 1 means drugs with the highest risk of abuse, while Schedule 5 is the least risk of abuse. Propofol isn't scheduled at all by the US Drug Enforcement Administration. This means that the DEA has ruled out that there is very little risk of abuse for propofol. The DEA has received comments and petitions from both politicians and medical care providers in the past to make propofol a Schedule 4 substance, but it has remained uncontrolled by the DEA and not scheduled due to how uncommon abuse of propofol is. How do the classifications of drugs change how they are administered?
um, I'm not sure that the classification changes how they are administered. It certainly changes prescriptions for things, which actually I don't do a whole lot of, but it changes prescription, like people's sort of thoughts on giving prescriptions, writing prescriptions. And for me, the biggest difference between um, scheduled drugs, scheduled 1, 2, 3, 4 drugs, and not being scheduled, like propofol is not a scheduled drug right now, is that the wasting of the drug. So, for instance, if I give half of a vial of fentanyl, I have to account for exactly where that half of a vial went, exactly where the other half went. I have to waste it, and it's quite a process. Whereas drugs that aren't on a schedule, so they're not classified as a scheduled drug, you don't have to do that, and it just eases the administration for us as anesthetists.
How much would your job change if propofol did become a scheduled substance?
If propofol became a scheduled substance, my job would be made quite a bit more tedious throughout my day. Since we use propofol so often and so much, and we like to call it titrating to effect. So, like if I have a patient who is getting, for instance, like an EGD or a colonoscopy for a GI procedure, I will give them enough to make them sleepy enough that they're not fighting or awake, and the procedure can be done, but also that they're still breathing. And that's one of the things that I went to school for, is to know how much to give as I'm titrating it. If it went to a scheduled drug, you would have to be way more diligent about keeping track of what has the patient received, what have I taken out. Propofol is kind of one of those drugs too, where like if all of the sudden your patient is what we call coughing or bucking and they still have a tube in them and you need them to quiet down a little bit, we grab a vial really quickly and we give it to them, just so like we make the emergence more smoother. And so if it became scheduled, it would be so much more tedious and a bit of a headache for us.
If propofol became a scheduled substance, could it negatively affect patients?
One of the reasons that propofol is not considered a scheduled drug at the moment is that it doesn't actually cause analgesia. So it does not take any pain away. It's not a pain relieving drug, like, for instance, an opioid is. It is only for anesthesia. So it just causes sedation or patients to go to sleep. The reason at the moment that the DEA has not deemed it a scheduled drug is because there isn't um, there isn't reason to think that people could become addicted to propofol, because it isn't one of those drugs that is like a pain relieving drug or a drug that like makes you feel euphoric. It just makes you sedated and go to sleep. I feel as if maybe if it became a scheduled drug, that there would be a lot more attention drawn to propofol, because at the moment, not too many people know about propofol because it's not a scheduled drug. And I think sometimes when we schedule drugs and we sort of highlight it like, oh, this one could be a bad one, then it becomes more on the radar of people who use drugs recreationally, and that could have a negative effect.
Thank you.
Propofol allows for easy recovery after surgeries, making same-day surgery more accessible. Propofol induces anesthesia quickly and smoothly and has a lower risk of postoperative nausea and vomiting. In studies comparing propofol with other intravenous anesthetics in day surgery, the use of propofol as an induction and/or maintenance anesthesia was associated with a shorter time to intermediate recovery. This allows patients to quickly and comfortably return to their normal lives after operations and allows them to return to their jobs. The quick recovery associated with propofol and same-day surgeries also allows for hospitals to schedule a greater number of surgeries because patients are not having to use inpatient resources. This allows for more revenue to be made by hospitals, their employees, as well as patients receiving same-day surgery using propofol.
Before surgery, do you educate patients on their anesthetic recovery process? What do you tell them?
I do. Before surgery, oftentimes patients have the question of how long is it going to take me to get over the anesthesia? How long before I wake up, I'm out of recovery, etc. And if they are only getting propofol or getting propofol and gas, I tell them that, well, they'll be in the recovery room for about an hour, and then they'll be sort of in the other area being watched for maybe another hour. And so it's probably a total of about 2 hours, and then they can go home. They need to be driven home by someone else, and we usually tell them for 24 hours, they shouldn't operate big machinery or something like that, just because they may still be a little sleepy. But most people feel, especially if you use propofol and you're having a same day surgery, most people feel like they can continue their normal lives the next day.
How do you see propofol affecting the economy of your hospital, patients, and your coworkers?
I think that propofol is, really, I I don't want to sound too dramatic, but it really is like a wonder drug that has come on the market for anesthesia in the last 15 or 20 years. Um, it allows for many, many more surgeries to be scheduled same day, meaning that the patient comes in, gets the surgery or procedure done, and then is allowed or can go home. There's no recovery in the hospital. There's no need to stay and use the resources in the hospital. These patients feel like themselves much, much faster. They can return to work much, much faster, or just their regular daily lives much faster. Um, so the hospital is able to schedule many more surgeries because it's not requiring the resources of having like a long recovery period. So that creates revenue for hospitals. For us as anesthetists, we're allowed to do many more anesthetics throughout the day. Really, we do one after the other. And so that allows us, of course, to have more revenue along with our surgical partners, the surgery team. And then also, it doesn't, since these patients are not having days to weeks to recover from some of these surgeries, it allows them to get back to their jobs, making the economy not suffer because of that.
Yeah.
Propofol is not a biodegradable substance and has been shown to be toxic to aquatic environments when found in water supplies. However, compared to other types of anesthetics, propofol is much safer for the environment. Inhalation anesthetics have been found to be much more damaging to the environment than propofol. Greenhouse gas impacts are dominated by uncontrolled emissions of anesthetic gas waste. Greenhouse gas impacts of propofol are comparatively quite small, nearly 4 orders of magnitude lower than dust fluorine or nitrous oxide.
How do you dispose of propofol?
I have been educated by my daughter, who did all of the research on this, that propofol actually should be incinerated. That is what the environmentalists say. However, um, I don't know of any hospital, at least here in the Twin Cities, that incinerates their propofol. What I do with my propofol is that I just squirt it into the garbage. Like, so if it's in a syringe, I squirt it all into the garbage, and the garbage, of course, is taken away and I'm assuming goes to a landfill. We do not put it down the drain though. So there's it, obviously it can get into groundwater if you are taking it out in the trash, but it doesn't go directly into the water supply because we're not putting it down the drain.
Do you think many anesthesia providers consider the environmental effects of the anesthesia that they give?
I actually do think that we do. I think, of course, there's much, room for improvement, as with a lot of environmental things in our society these days. But we're taught in school, for instance, there is a certain rate that you have to have fresh gas flowing through your machine while you have the gases Sevoflurane, isoflurane, and desflurane are the three gases that are sometimes used in anesthesia. And we have to have a fresh gas rate that is flowing in order to scavenge all the extra gas, as patients are breathing it out. Um, and then there's also, like, for instance, there's been this huge push lately to go only to sevoflurane because it is so much better than desflurane for the environment. Desflurane actually eats away at the ozone. So in my hospital at Ridges, we don't even have the option anymore. We don't have desflurane, and I think a lot of hospitals are going that way as well. So we do think about the environment. I think that we could do a lot better, as really across the board in healthcare has a lot of waste. But I think everyday people are striving to come up with better options for those things.
Nice. Thank you.
Thank you for having me.
All right, let's make sure that works. Wouldn't that be funny if I like recording?
Most people getting same-day surgery receive propofol as their main anesthetic. Propofol allows for a faster recovery, so surgeries that 15 years ago took 2 days to recover from can now be done same day and patients can go home. As I previously stated, propofol makes surgeries and the recovery processes very comfortable, much more so than other anesthetics. From a societal standpoint, this allows more revisits for healthcare and hospitals, as well as patients to return to work faster, increasing overall societal productivity. Propofol also allows for comfortable surgical experiences and not harming the people of society who need surgery any more than they already are. In conclusion, propofol is an important general anesthetic due to its rapid induction and smooth recovery, making it particularly suitable for same-day surgeries. Despite its powerful anesthetic capabilities, propofol remains unscheduled by the DEA due to its low potential for abuse. Its environmental impact, while not negligible, is significantly less harmful than that of inhalation anesthetics, making propofol a more eco-friendly option. Overall, the use of propofol enhances surgical efficiency, patient comfort, and hospital throughput, ultimately benefiting both the healthcare system and society at large by enabling faster recoveries and increased productivity. Thank you for watching my video. All of my sources will be listed in the description below, so if you want to see them listed in MLA format, please click see description.